Okay, this is Dr. Montleone again, Dermatologist Choice, and I'm making this video as a helpline so that people understand how to use the TCA at home. I happen to have the TCA 15. In the office we use 15 and 23. Now I have it higher, but I don't want anybody at home to use anything more than 15 or 23. Okay, but I'm going to show you how we apply it. The first thing you should do is always take a little bit of it and check it by your ear right here to see if you have an unusual reaction. So that should be the first thing you kind of do with it. After you do that and you find out it's really nothing unusual is happening, then you have to wash the face. Then you use the glycolic TCA pads to clean the face. Once you get it nice and clean and free of any oil, that allows this to penetrate deeper. Now, once you start, you should make one pass, meaning you go once, just like this, and just cover the area one time only. And then you just take your hand away, you see if you get any reaction. Now, if you don't get any reaction or no tingling, you may have to do it again. So you just go over the same thing twice. Okay, and you just go twice until you cover the whole area. So when you have the roller ball, which is the same thing as this tip, you do the exact same thing, but you're just, of course, you're rolling it on versus using the Q-tip like I have it in a bottle here, which is easier. Now, if you still don't get a tingle, then you can make a third pass. But when you do the third pass, instead of going up and down, you try to go across, just like this. And you don't miss any areas. And you see if it stings. Once it begins to sting a little bit, you're done. You don't have to go any further. That means that little bit of stinging means that top layer of dead skin is going to go off and scale off in the next few days. Sometimes it takes 7 days. Once that skin scales off, that's what gives your face the nice bright look. In addition, between the pad and this, you'll get deeper penetration into the dermis. Now, you can, after doing this, if you see you haven't had a severe reaction, you can always put the Ultra Anti-Aging Cream on afterwards to make it penetrate deeper. The deeper you get it, the better it works. But this is not something that's going to be all clear by tomorrow. These low, just like retin-A, real retin-A, tretinoin acid, not retinol, which is inactive, nothing. I'm talking about real retin-A, takes time to penetrate deeper, and over time it continues to improve. So I have patients that come in every month that have been having it done, so that you see what kind of reaction, just like I did it. And now some people, you could, if you really want to get it deeper, do the same thing you can go 5, 6, 7 times. But now the more times you go, it may turn red, it may sting more and burn more. It means it penetrates more. Do not do this the day before you go to a wedding, okay? You wait. And so that, now, is there any other question I should have? Girls, can you think of any question I missed?
How long does it take to start peeling?
Well, the peeling action takes 2 to 7 days usually. And after it scales off, so if you have some place to go, you schedule it for like 8 days, and now you're gonna look really sharp. But the long-term effects is that it's gonna penetrate into the second layer. So let's review. The first time, you check it out here by putting a little bit there. You make sure you get the pH and the pads to clean the skin to get free of oil. And you just go one pass, just like this. Okay, all the way over. And then if it doesn't sting enough and you don't get any tingling, then you just do it again. And then you go the opposite way. Okay? And you want a little bit of tingling. Sometimes it may burn, may turn red. Usually it doesn't turn white. I tend to be in the office, I tend to make it turn white, but that's not something you should be doing at home. You should just get a little tingling, stop right there. That'll give you the benefit you need. And that's how you do it. And then the other thing is, If you don't use the Ultra afterwards, you can also, then you start using the moisturizer, either right afterwards if it stings a little bit a lot, or you can use the moisturizer in the morning, and that helps make the scaling not so noticeable. And if it turns a little bit red, just use the moisturizer, it's nothing to worry about. Any other questions, girls?
I don't think so.
No?
Thank
You
Okay.
did a good explanation.
All right, this is a helpline. I hope everybody watches it and put any comments or questions on it so I can maybe answer those. Thank you.
Thank you.